Personal health records. The Wave of the Future, presented by Kanzada Pierre, Jessica Prophet, Miranda Russell, and Deirdre Shawley Dick. What is a personal health record? A PHR is information about your health compiled and created by you through your health insurance company, healthcare facility, your employer, or other service provider. A PHR is a tool that allows you to collect, track, and share current and past information about your health. A PHR prevents repeating of routine tests and can save you money. It gives medical care providers more insight into your health history. This health record is updated and maintained by you. What does a PHR contain? Section 1. Identification sheet, personal and demographic information. Problem list, contains significant illnesses and surgeries. Medication record, lists current medications, supplements, and allergies. History and physical, documents describing major illnesses, surgeries, significant family history of disease, health habits, current medications, and notes on findings the physician discovered on examination. What does the PHR contain? Section 2. Progress notes. Information documented by the healthcare team, including doctors, nurses, therapists, and social workers, reflecting your treatment response, observations, and plans for future treatment. Consultations. Opinions made by other physicians as a second opinion or by physicians in a specific field of medicine. Physician's orders. Your doctor's instructions to members of the healthcare team regarding your care. Imaging and X-ray reports. Reports on the findings of X-rays, scans, and ultrasounds. What does the PHR contain? Section 3. Lab reports. The results of these tests of body fluids such as blood, urine, and cultures. Immunization records. The documentation of immunizations given for diseases. Children's immunization records should be maintained by their parents and kept with other important papers. Consents and authorization forms. Consents for surgery, treatment, admission, and release of information for billing purposes. Additional reports that may be part of a PHR. Operative reports. Contains information about the surgery performed, names of surgeons and assistants. Pathology reports. Identifies tissue removed for examination, the diagnosis based on the findings. Discharge summary. A summary of the hospital stay along with the reason for admission, significant tests and findings, procedures or therapies provided, treatment responses, discharge condition, and instructions for activity, diet, medication, and follow-up care. Finally, some of the other reports you may find in your PHR are ER visits, physical therapy, and home health care notes.
How to use personal health records. Personal health records allows for the patient to access from a secure website their own health information. Allows patients to view their lab test results, future doctor's appointments, and their home medication lists. It also allows the patient to be able to send messages to their physician when they are experiencing symptoms that could be resolved before it became an acute situation. Allows the patient to a secure access to view insurance benefits, make bill payments on hospital services. This is a diagram of a personal health record. In this health record, you would have the patient's personal information. You would have the patient's emergency contact numbers, insurance. Patients are able to make appointments, doctor's appointments. Patients are able to review their results for labs, results for x-rays, and patients are also able to review and update their health insurance. Managing medications with a PHR. It allows the patient to list their current medications. It helps the patient be able to discuss their medications with the physicians and other healthcare providers on admission into the hospital. Also allows an accurate list of the patient's allergies to be reviewed. Preventative care and education. This allows the patient to be educated on surgical procedures and new onset diagnosis. It includes summaries of past and present surgeries. The future of personal health records. The PHR plays an important role in the transformation of the healthcare delivery system for the consumers who are now involved in their healthcare decisions. Several companies are hiring more informatic nurse specialists to train healthcare professionals and to teach consumers on how to use a PHR and its benefits.
Who can access PHR? Healthcare providers. This can be used to contact your family if you're unable to give consent in hospitalization. It can be used to get accurate medication lists, obtain an accurate health history, improve communication between healthcare providers, and can be updated with the most recent health findings. Your primary care provider. They can use this information to see and update your medications, see and update your diagnoses, and can see diagnostics such as labs, cultures, and imaging. The insurance company may use your PHR to obtain your policy information, obtain information regarding your hospitalization or encounter with your primary care physician, and contact your physician if they need more information to process your claim. You are the most important person that has access to your PHR. It is your responsibility to ensure that it is correct. You need to make sure that such things as your emergency contact, your insurance information, and your demographics are correct. Your physician can help you in ensuring that your medication list and your health history are accurate.
Benefits and drawbacks of a personal health record. A divided frontier. Benefits and drawbacks. While personal health records are becoming more useful and mainstream, there still exist as many cons as there are pros. Pros and cons can be subdivided underneath provider concerns and patient concerns. Provider versus patient concerns. Patient concerns. The benefits of the personal health record to most patients, as shown in anecdotal articles as well as studies, show that patients feel empowered, secure, and knowledgeable about their health care when they use personal health records. They like the ease of access with everything in one place and the ability to just hand their doctor the document or flash drive or website address for their PHR. Also, with the secure messaging functions that most PHRs will have, they can reduce out-of-pocket expenses for office visits that they don't need to go to. As well, it is noted that 60% of Americans are definitely interested in PHR. Some of the cons or drawbacks to PHRs from the patient perspective are confusion. We're talking about patients that are not computer fluent or computer literate. They don't understand how to enter their information into the PHR, or they don't understand how to interpret the information in the PHR from their providers. A huge concern for patients is data breaches. They are worried that the information in their PHR will be leaked out or misused by even their trusted medical personnel. As well, patients are concerned about getting lost in all of the information. That's the flip side of having information all in one place. It can also be overwhelming. Additionally, it is difficult to integrate all sources. Not all providers will be using the same systems. Not all PHRs will be accessible through all provider systems. Finally, although 60% of Americans are interested in the PHR, very few Americans are actually using them, so there is a great divide between those two aspects. Healthcare providers recognize the benefit of PHRs, but they're not completely sold on the idea. Some of the things that they appreciate with the idea of the personal health record is the continuity of care across disciplines. As well, PHRs would provide information quickly in an emergent situation. Patients with complex medical histories will have all of their info in one place, which would make it a lot easier for the provider to get a complete picture. And the efficiency and clarity of orders will help doctors. They can look outside of their own organization and see what other physicians or consultants have put in for that patient. And a lot of them see a benefit for it to be a good resource for providers, although they're not sure that it's a great tool for patients. They like the provider input aspect a lot more than they do the patient input. As far as cons on the provider aspect, there's no system for reimbursement yet for the teleconference of health appointments or for the secure messaging features. So although that's an option that many patients are appreciative of, the doctors are just not sure how that will work yet. As well as that, they do not understand how the EMR and the PHR would be seamlessly integrated. As mentioned in the previous slide, everybody has a different system, and unless it's a national program, it would be hard to integrate everyone's programs together. Physicians would be able to access all types of PHR, whether it be a slide card, a flash drive, or a cloud drive. That could be difficult in an emergent situation, and it could also be difficult in the office. The logistics of that would need to be worked out and ironed out as the PHRs become more mainstream. Doctors also have the opinion that patients are not computer fluent enough to successfully use the PHR. They're concerned that patients would put information in that's false or misleading. And they have the potential for incorrect order entry, whether from the patient or medical staff, although this is a concern that has always been a problem, regardless of whether orders were being entered by paper or into an electronic medical record. As we've discussed, a personal health record, or PHR, is a tool with information combined from the healthcare providers as well as input from the patient to create a